Hello, everyone. I want to welcome you today as we will be learning more about the latest offering from the Center for Health Affairs. My name is Endrit, and I'm the Technology and Data Director at the Center for Health Affairs. As the oldest natural hospital association in the nation, with a core mission of acting as a convener impacting healthcare in Northeast Ohio and beyond, it is my pleasure to announce today the launch of our Collaboration to Innovation Grant. The Collaboration to Innovation Grant is a partnership with IPC Global to provide the opportunity for one research project to engage the latest capabilities in cloud computing by leveraging the inProcess research platform. Today, we will cover details on the grant offering, as well as the platform where the research will take place. For the note takers in the audience, please remember that the deadline to apply for the grant is Saturday, April 30th, and the winning project will be announced on Friday, May 13th. The attached information below has the submission criteria and information on submitting the grant directly to the Center for Health Affairs. Before we talk about the grant, I would like to introduce my co-host today. Joining me today to discuss the Collaboration to Innovation Grant is Mark Meersman, the Managing Partner at IPC Global. Mark, welcome.
Thank you, Endrit. Happy to be here.
As everyone reads over the submission criteria, you'll be pleasantly surprised that in the spirit of facilitating research with an innovative platform, the grant proposal process has also been developed with an ease of application in mind for each researcher. Before I describe the grant opportunity a little more, I'd like to set the stage a little bit. And before I pass it over to Mark to talk about inProcess research, where the research project will take place, I want to talk about what does inProcess research bring to the table? Well, quite simply, it's going to make cloud computing capabilities at the fingertips of each researcher. So cloud computing is a resource that just a few years ago, we all thought belonged to Fortune 100, 500 companies that was out of reach for most organizations that everyone is a part of. However, the technological capabilities moving towards cloud computing is the next digital transformation age. So why not democratize that process and make that capability available to everyone? And the COVID-19 pandemic has really pushed an acceleration towards digital health offerings and towards the need to implement cutting-edge technologies at everyone's fingertips. Because a few of the general benefits of cloud computing are, one, you can accelerate adoption of your products and services. We all would love to offer more AI, ML, deep learning capabilities. However, as we talk about data in the petabytes and the exabytes, it makes it harder and harder for each of our own individual systems to do the work we wanted to do in that realm. We all want scalable services. We all want to see cost reduction as well as enhanced security. The modern cloud offers all of these. So why not make such technology available to all of us? However, I'm talking about cloud computing resources right now in the general. Now imagine taking that and applying that towards research work. Taking those benefits and applying that to your research projects is even harder when you have to think about HIPAA compliant security, a scalable platform that provides a place for several researchers, a whole team, different departments, organizations in there. So while organizations are behind in implementing cloud computing, they're even a few further steps, if not more, behind in applying that towards research. So this is where the innovation out of IPC Global comes forward in their inProcess research platform. Before I push to Mark, I want to give everyone an example that I think we've all heard of through COVID-19 with Moderna. They decided to leverage cloud computing for research prior to the COVID-19 pandemic. Once the pandemic hit, they were able to leverage that scale computing and that storage infrastructure with their data and really use their drug design studio to get a vaccine for COVID-19 in record time. So that is part of the reason for our grant and part of the reason that Mark has worked to bring such an innovative platform before. So Mark, before we dive into discussing the inProcess research platform, can you tell me a little bit more about IPC Global?
Certainly. We're an enterprise data analytics firm that leverages the cloud in order to do automated machine learning, and most importantly, networking of data together in order to come up with findings that haven't been made before.
So with your extensive background in the history and driving change all these years, you saw an opportunity to help to help enhance cloud computing as an asset for research. Can you provide some background on how inProcess research came to be and the benefit it offers each researcher using the platform?
Certainly. So for your audience, each of the health systems and research environments that we've done across the US and Canada have each been private clouds. And fortunately for that, you can create a HIPAA compliant private cloud from which the data can be managed and the collaborators, the investigators can work, and it can be audited and validated to the ends that are required. And so we were able then to use that. And fortunately, you pay for what you use. So we're able to very effectively estimate and control costs as it relates to any research initiative, regardless of data volumes or processing time.
Great to hear. So can you explain the tech stack behind inProcess a little bit and what cutting edge technology making that a resource instead of a challenge for each research project?
Yeah, the first bit was under the name inProcess Research, by which we needed the ability to network data together from various sources without having to take that very costly step of building a data warehouse. We pull from various systems at the same time, we network the data together, and then we publish it in statistical and machine learning based models, from which the results of our findings are then made evident and used certainly in the various papers. One of the key technologies we started with, of course, was cloud computing. So we chose AWS as that platform, though in theory it would work anywhere. AWS gave us a lot of great capabilities and innovations that weren't necessarily found on other platforms. So we use their compute, their storage, their automation technologies in order to do what we do. We added on top of that a data integration analytics technology from Qlik, Qlik. And that particular technology also allowed us to very effectively enable the researcher and the PI and their team to do the work without having to bring in developers, a lot of self-service capabilities that aren't easily available in other technologies as like. We then provided some write back and workflow automation because we actually automated the data validation process. And as we validate data along the way, it remembers that. And so begins this flywheel approach to validated data and making it reusable across multiple research initiatives that are going on. So a lot of powerful capabilities that we brought to the table as part of inProcess Research.
Thank you. Appreciate that because that research and data automation was my next question as well. So you handle 2 in 1 right there. So how do you take the cumbersome, lengthy process of analyzing data from different sources? I'm thinking EMRs, internet IoT devices, publicly available data and everything. And that is very cumbersome to put in one place and be able to analyze. And how do you turn that into a real-time analysis and give that capability back to the researchers?
Yeah, for the first part of it is really just an incredible differentiator where we'll take all of those sources, as you mentioned, and some, literally the bedside machine, the IoT devices, the EMR data, the data that's coming out of CMS, the data that may be coming out of your various REDCap studies that you've already done, and we network it together. Fortunately, the networking of the pieces, the way we stitch it together is we use the values within the data to find the matching versus what traditional warehouses might do, which is require you to match on the column names themselves. So we automate the linking of the data from a lower level. Now, some of it does need some engineering work. Like you said, if I was pulling from a Fitbit data, I would use a registry and I would need to key that back. But those things are done because of our ability to, if you will, onboard or enroll the patients. We can bring the keys in at that time. And there's other mechanisms, whether it's the room that the patient is in at a given date, time, in other mechanisms that allow us to associate the device with the person, with the study that what's going on. Some of it does get gray, and in the gray areas, we do allow a computer-assisted data integration where we can help the computer match things together. At the end of the day, though, if I've got 5 or even 50 data sources that I'm pulling from, all of them are keyed and networked together to then answer a question that we have at hand.
So your last answer is making me think that there's an opportunity for economies of scale here, taking all the different data connections and all, preparing all that data for research. It seems like there's multiple returns where one data set can be used for several research projects in the platform. Is that true?
That is true. And actually, there's 2 really important pieces. There's the first bit I spoke about, which is where we engineered the integration of the data. All that's reusable. But also, let's say I pulled a cohort of that data out for a given research and I had some findings. Well, there's often tangential findings that we're looking for associated with that same question. All of the work in validation and modeling that was used for that is immediately reusable. In fact, you could even say, well, let me just try and prototype. And in the same day or in the same week, at least, you could then say, I think I have something here. And that's really important that all of your researchers know that if it was discovered before, it wouldn't be research. You guys are going in an area where you need to try and fail and discover, of course. But what if we could learn quickly and go, oh, not there, but there. And that's what our platform does a great job in doing, is allowing them to rinse and repeat until they get their teeth into that one thing that they have that intuition, as professionals do, to be able to find those things.
So as the name of the grant hits, that in addition to leveraging the cloud computing for research with inProcess Research Platform, their platform also facilitates collaboration during the research process. Because we think about a research team could be a mixture of individual teams within a department, several departments, different organizations, different health systems, and or independent practices. So how does inProcess Research go about fostering collaboration, thinking of how dynamic teams are made? And you also can also describe the impact of the platform it can have on community health research, thinking how it can bring together so many different researchers?
Yeah, for sure. So the platform in and of itself, you will, through MFA, be connecting into the collaborative place. There will be nothing you will put on your laptop or anywhere else. You will log in and work from the platform. You will be enabled with if not all, of the tools and capabilities that are there in order to meet the objective of your proposal and the benefits here of this grant. So my point being is, all of you will be on the platform. All of you will be working parts or many parts of the platform along the research process. Because we have automated pieces of that process within process research, you're able then to just say, okay, I'll start here and then I'll get the output there, and we'll move you along this roughly 7-step process of doing your research. But I think the key is the fact that we're all working together on the platform. There's nothing brought down to anybody's device or working elsewhere. Even if we needed some advanced ML or device or IoT integration, all of those capabilities exist through the cloud platform of inProcess.
Loving everything I'm hearing it, and the fact that there is this synergy about the work we do as a community organization and bring an innovative process to the research for our health systems, as well as university researchers and everyone beyond, because this is a tool that can be applicable beyond just healthcare, even though this is our focus today. My final question has to also do about the fact that you've become a published researcher using the platform. So I would like for you to touch up a little bit on how fast it's helped other researchers work and your own personal experience with your published research there.
Yeah, so I'm very blessed to do what I do, specifically around data integration, data modeling, research, and supporting really the innovative ideas of the providers out there, and ultimately the principal investigators. So you'll find me out there in ResearchGate a half a dozen times with regards to various papers that happened during COVID, that we integrated data from various sources and followed the process we just spoke of, that gave literally the results that went into the paper. When you look at any of the papers that they have my name on it and others that we supported, you'll see the output of the statistics and machine learning output right directly in those reports. And it was that was really powerful because we were doing it during the height of the pandemic. And that means these investigators were having full-time work that they had to do, but they knew that they could sink their teeth into something. So my point being is this thing is fast and it's capable, and it's not necessarily asking you to make this your full-time job, but if and when you apply and are able to work with us on the platform, it will be very complimentary and very fast turnaround time in producing the results that you'd be looking for in your ideas.
Thank you, Mark. Much appreciated, all that information and all that sharing with us. Now that we have covered inProcess research platform and how every investigator can benefit from using the platform, I'd like to offer some more information on the grant opportunity and just some more details for everyone listening today. The Collaboration to Innovation Grant is an opportunity for one research project to utilize the inProcess research platform and champion a collaborative decision-making process and democratized analysis process that will enhance and expedite all research. So Center for Health Affairs, in teaming with IPC Global, would like to invite all researchers that wish to take advantage of such a cutting-edge tool to apply for this grant. Now, as I mentioned earlier, we're a 100-year-old organization that is based in Northeast Ohio. However, as the Northeast Ohio Hospital Association, we are making this grant opportunity available to all health systems in Ohio and beyond in the United States if anyone would like to apply. While you'll see below, the information attached below on the grant does have the scoring information. Please reach out. My contact information is below as well if you have any questions at any point about scoring or about the grant or the platform at all. And while we are opening this to all health systems and even research at universities, we do have some research topics and priorities from the Center for Health Affairs. So in the scoring, it is described that we will prioritize anyone that focuses on healthcare workforce, healthcare policy, leadership development in healthcare, social determinants of health innovation, healthcare systems, health outcomes and quality improvements, healthy communities and population health, as well as health accessibility, health informatics, and technology. While these are the center's priorities, we accept all research applicants and all different research topics in here. So please, if your topic is covered one of these, perfect. If it's in a different category, please go ahead and apply, because we are considering anyone that provides healthcare research in the United States. Thank you everyone for joining us today. And as a reminder, the grant deadline to apply is Saturday, April 30th, and the winning project will be announced on Friday, May 13th. So please send over your grant proposals as soon as you're able to. The attached materials below has more information on how to apply to the Center for Health Affairs. Thank you very much and have a great rest of your day. Thank you, Mark.